Okay, so I wanted to replace that little piece that got cut off for incompetent cervix, and I wanted to talk a little bit about cerclage, not for a long period of time. But a cerclage is a suture that's placed around the cervix, and I'm going to get you a little picture of that if you give me 1 second. And there it is. Okay, so you can see it's this little suture that goes around the cervix. Now there's a couple different types. The book talks about the McDonald's procedure or the Sherrod-Carr procedure, and there are some differences, but we're really not going to go into them. I don't think NCLEX is going to quiz you. What I would like to talk about are the risks of the procedure and the care following. So the biggest risk for cerclage is infection. You're putting foreign material into the cervix. It's not typical, but we will monitor mom for signs and symptoms of infection and teach her to report a temperature of greater than 100.3. The other thing that we might see is mom might contract through the cerclage and go into preterm labor. So typically following her cerclage, we're going to keep her in the hospital for maybe a day or two, keep her on the monitor. Now most of these are done between 12 and 14 weeks, so putting her on a fetal monitor when the uterus is just barely out of the pelvis may not be an option, but we can palpate, we can ask her if she's having cramping. Bleeding and spotting, tiny bit, is pretty normal, and a little mild cramping, but we will monitor her. Sometimes there are antibiotics that are given to prevent infection, and then she'll usually go home on bed rest and what we call pelvic rest. And pelvic rest means nothing in the vagina, particularly no sexual intercourse until the doctor says it's okay. It's usually for about a week before and about a week after, although some doctors are more or less strict. And bed rest can be a couple days or it can be a couple of weeks with a cerclage. So that's really what you need to know about that procedure. If you have more questions, you can bring them to class, but I didn't want you to think that you lost a significant amount of material there. Okay.